Another example is that if they accidentally touch something, they perceive they need to keep it to avoid others from being contaminated by touching the possession the individual has touched already. The second reason is they feel distress in discarding them, and therefore they store things at active major living space, such as the living room, bedroom, kitchen, etc., instead of some peripheral regions of the house, such as the garage, balcony, etc. The original intended use of the active areas is given up to clutter those possessions. DEF. Hoarding causes impairment, distress in different areas of their lives. If hoarding is a consequence, symptom, or an effect of other medical conditions, then it should not be diagnosed as hoarding. Moving on to the specifiers. Excess as acquisition. Individuals feel difficult to discard their hoarded items given that they acquire too much items or there is no available space. Research shows that 80 to 90% of hoarders have no available space for them to store their hoarded items. Next, 3 types of insights. Firstly, good or fair insight. Patients recognize such behaviors and believe that they are annoying. Secondly, poor insight. Even if patients are mostly convinced that they have such behaviors, they do not regard them as problematic. The last one, absent or delusional insights. Patients are entirely convinced that their behaviors are not problematic, not causing any troubles. Differential diagnosis. If the symptoms are the direct consequences of these disorders or features, then patients should not be diagnosed as hoarding disorder. It is important to note that OCD patients are not usually warranted as excess acquisition, not because they do not really over-acquire things, but third parties intervene in the situation, such as the family or even the government. One possible reason for government or authority intervention is that the case raises environmental concerns. The environment there is not hygienic. Same as here, if the symptoms are the direct consequences of these disorders or features, the individual should not be diagnosed as hoarding disorder. A report reviewed a case that a male adult hoarded for 20 years after the death of his only son. We could see that there was a comorbidity of hoarding and depression. Associated features. Indecisiveness. It is a temperamental prognostic factor of individuals with hoarding disorder and their first-degree relatives. Individuals cannot decide which item to leave, which is also associated with difficulty planning. They do not have a plan on how to deal with the challenge to discard their less useful possessions. They have deficits or problems in organizing the task of discarding their items, associated with task organization. Also, they have difficulty deciding what's useful or not, so they keep things longer than others and avoid leaving things.